Hello, in this video, I'm going to be answering the questions, are walnuts good for you if you've had breast cancer? First, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. So why walnuts? Well, one of our viewers put a comment in asking us to do a video about walnuts. Interest in walnuts as perhaps protective or associated with better breast cancer outcomes has come from epidemiologic studies, which are studies of thousands and thousands of people and their eating habits and characteristics of their health, or if they have breast cancer, their breast cancer characteristics. And animal studies both have raised some interest in walnuts as a possible way to modulate breast cancer growth, that is, change it. Walnuts are really interesting. They have a lot of compounds in them that are anti-inflammatory. Specifically, walnuts have omega-3 fatty acids, antioxidants, and also some plant compounds that reduce inflammation. And because these compounds may be involved in how cancers develop and spread, this is why walnuts have been investigated and why they're of interest for people who are nut eaters and have had breast cancer or are interested in reducing their risk of breast cancer. Now, it's important to know that there's no food compound that can take the place of standard medical treatment that's been studied in thousands and thousands of people in rigorous, scientifically controlled studies. But lots of people want to know what else they can do. So an animal study done in 2019 by Dr. Hardman showed that tumors in mice who were fed a lot of walnuts, animal studies use a lot of whatever it is we're interested in studying, had smaller tumors and differences in messenger RNA of the tumors that they had. The same investigators, Dr. Hardman, published a study in humans looking at messenger RNA in people who had been exposed to the compounds in walnuts and showed some changes in that messenger RNA. That's comes from the DNA, then messenger RNA is made, and then proteins are made. So there's some preliminary work that certainly is exciting. There's been nothing new since 2019, and if you are a longtime viewer of our channels, you know that whenever we don't see things sort of have legs and be sustainable, it usually means that research hasn't been confirmed. So there are no large randomized studies of walnuts that have been published yet at this point. A large cohort study, the Nurses' Health Study, showed that nurses who were more likely to eat nuts in general, not specifically walnuts, were less likely to have a breast cancer recurrence. Now, we have to be careful with this kind of longitudinal lifestyle study because it's very likely that nut consumption is associated with other healthful behaviors. For example, perhaps fewer carbohydrates, perhaps fewer highly processed foods, for example. And it's hard to control for all of those factors, as well as treatment that those people who eat more nuts might have had. So we have to be careful from those sort of associative studies, but they are intriguing and they prompt additional research. So what's the bottom line? Should you be eating walnuts? Walnuts are good because they help fill you up. You just need a handful of nuts. They're part of a healthy plant-based diet. They are not going to interfere with medications like tamoxifen. And if you enjoy them, you can eat them knowing that, if anything, they may help you long term. Thanks for watching, and we'll see you next time.